Welcome, everyone, to the Transformation Nurse Academy podcast. This is our weekly episode, Talk with Kevin, where we cover topics for all nursing fields with extra emphasis on emergency and critical nursing. Get ready for candid discussions that explore the vast landscape of nursing and beyond.
So we're going to talk about a story that's very hard to hear. So if you don't want to listen to this story, or if you have some kind of issues that you've had in the past with your own children, maybe you should tune the fuck out, or I don't know what to tell you, but it's going to be a tough story to hear. So if you're not ready for that, now's the time to fucking leave and shit. There's a fucking dial that says on and off. So turn that shit off.
Or if you work at and don't want to hear this shit, dial out.
Right. Just know that this is a tough story to hear. So share with us a story about how your child swallowed a button battery, and you take it from there. And I'm going to may interrupt you with a question, so don't be mad at me.
Oh, that's okay.
All
I
right.
love questions. So my little one, her name's Luna. She'll be 3 next month. But when she was 19 months old, February of 2023, she had a little cold and started to recover. And I noticed, like on a Thursday afternoon, all of a sudden she started like vomiting and kind of retching about 7 times. Thought that that was a little bit odd now that she was starting to recover from the cold. Really didn't think too much of it. Next day, she started spiking temps, low-grade fevers, 99.5 up to like 101. Again, really wasn't that concerned at that point in time, but her fever started spiking up to 103, 103.5. Made an appointment with her pediatrician on a Tuesday. Of course, they swabbed her for COVID and flu, RSV, all of those fun things. She was negative. When I saw the pediatrician, he said, well, I think it's just strep throat. And I said, really? She's a little one. Littles really don't get strep throat at 19 months. It's, just something that doesn't really happen all that frequently. And he didn't even swab her. So I brought that up. I said, you didn't even swab her. And he said, well, just looking.
Just looking.
Just looking.
I can see shit from here.
It looks like she has strep throat.
I'm a magic doctor. I can see through I got my own x-ray vision. Calm down there, lady.
So he said, oh, I'll call in some antibiotics. I think it was, I don't know, Augmentin. And so those antibiotics, he never called in. So, of course, not that that matters.
And you said she was 19 months old?
Yeah.
All right.
So I had to give them like 2 more phone calls to remind them to send the order in to Walgreens. Started her on the antibiotics. I think it was like Wednesday afternoon, finally got the antibiotics. This was on a Tuesday that she saw peds. So started her on antibiotics. I'm still giving Tylenol around the clock because of the fever. And on Thursday, she started presenting like with a really barky cough. And I could tell that she was having difficulty swallowing. At that point in time, she was still being fed through a bottle. Of course, she did eat things, but now I'm noticing, well, she's not even eating and really not drinking much. So I was concerned about dehydration and especially, with the vomiting that she was having as well. So that afternoon took her over to Oh, and I did take a listen to her lungs before going in, and she was a little
Typical
diminished
nurse.
to the left. Yes. I'm not a peds nurse, but lung sounds are lung sounds.
Lung sounds are lung sounds.
Yeah, exactly. So I took her over to we got called into triage, told the triage nurse some of my concerns, and I said, I think she really needs a chest x-ray. Triage nurse's response was, well, don't tell me, tell the doctor. Okay.
Oh, shit. All right.
Yeah.
Why would she say that? I don't get that.
Well, I don't either.
All right.
I'm not her, so I don't know
I got you.
why in the fuck she said it, but she did. And so that kind of set the stage. Like that really pissed me off. And I didn't feel like from the beginning that I was listened to about Luna's symptoms. It was like, okay, you're just a number. Here you go. Go wait out in the waiting room now and they'll call you back. Okay. And so we did get called back to ER Bay probably like within 15 minutes. It wasn't long. And so they started a line on her. Of course, it infiltrated as soon as they left. Not that that really has anything to do with her injury. But again, I was concerned about dehydration. They gave her Decadron. No one came back in to reassess after they gave a medication. I mean, you should be reassessing your patients no matter if it's a little one or an elderly patient.
Right.
I did not know where the call bell was. Side rails weren't up. I couldn't get the side rails to work. And so I didn't want to leave my daughter. She's attached to the monitor. She's crying. She's upset. She wants to be held. So I just waited for 45 minutes until the attending came in. And the attending said, well, I think she has the croup or she has the croup. And I told her about my concerns and I said, can we at least just get a chest x-ray? No, it's not necessary. Her lung sounds are clear. This is just respiratory and I'm going to discharge you home.
Shit.
Yes. And I, again, brought up my concern about dehydration. I said, she didn't even get these fluids, the IV blew. And she said, well, how would you feel if you were sick for the last week? You wouldn't feel like eating or drinking.
That's what the doctor said.
That's correct. Yes.
Woo.
So again, I was a little like steamed and pissed off about the whole experience. And then this fat nurse came in, and not that that has anything to do with it, but she really irritated me when she was giving discharge instructions because she barely even looked at me. And she's still talking about things to do when you have croup, and she's walking out the door. And I'm like, oh, she's not even like engaged in conversation. So I just thought that was odd. So anyway, bottom line, we left. I brought Luna home. I got her into like the steamy bathroom because I was concerned too about this barky cough. She really did not get much relief from that. Friday, the following day, very fatigued. I mean, she's been fatigued this entire time, but it was just more than her usual over the last couple of days. Not wanting to, well, she's not eating at this point, but not even taking like the Pedialyte, nothing by mouth except her meds. I was still able to push meds, the Tylenol, the Augmentin. And the attending in the ER said, well, you don't even have to give the antibiotic. It's not necessary. But if that's what you want to do, go ahead and give it.
We don't give a shit. Do whatever you want.
Yeah,
You're
do
okay.
whatever you want. Yeah.
Holy shit.
Yeah. So next day, Saturday, Luna did not wake up. I mean, she's in her crib and no interest in even getting up out of the crib, even for me to hold her. She just wanted to lay in bed. Not eating, not drinking, still spiking temps. But my concern by like 3 o'clock is now I can't even push the Tylenol in her because as soon as I would go to administer the medication, she's choking. It's not retching, she's just like choking as I'm pushing the meds. And then she starts coughing, and these green little specks come up. So I put them in a paper towel, and I'm like, wow, I've never, ever seen this in my career. I don't know what in the hell this is, but we're going to go back to the ER. Those specks, it was the corrosiveness of the battery. That's what it was.
That's craziness. So
I'm
how did
thinking, well,
did you know? Did you know at the time that it was the battery?
no, I did not. I was thinking, well, I don't do peds, but is this like valley fever? I don't know. Like there's something, why is she coughing up? It almost looked like mold.
Hmm.
I was thinking it was mold or I don't know. I've never seen anything like it. And I'm not going to take the time to try to do Dr. Google. I don't believe in that anyway, but I'm like, I know that this warrants another visit to the ER. So back to we went. And of course, they didn't give a shit when we got there. I showed the triage nurse the bag, the specs, no comment. She said, "No, I don't need the whole history from the week. Just tell me what's going on now." That was her fucking
That
response.
was the doctor's response.
No, that was triage nurse.
That was a triage. So
Hmm.
again, they didn't listen to you for the second time.
Right. And I did tell her, I said, I'm a nurse. To me, what I'm telling you is important. So you have the full picture.
But if
No
she didn't see,
response. She didn't say one fucking thing after that.
yeah, they usually talk to you like how they want until they find out you're a nurse too, and then they change their attitude.
But she didn't change her attitude and she didn't want to hear what was going on with her.
Even when you told her that you were a nurse, she still didn't say shit.
Nope.
Oh shit.
No.
All right, well.
Yeah, so now we go back to, I don't even think with that visit we went to the waiting room. They just took us right back to the bay. And it was a fairly new ER nurse. I think she said she's been a nurse for like a year. And so she was very nice. I didn't have any complaints, except I did notice like they were not doing any type of hand washing, writing shit on their hands.
On their
The,
hands or on gloves?
well, you know what? You're correct. Gloves. Sorry.
No, no, I just
Oh,
want
yeah.
to.
So they're going back out to the nurse's station to document with these shitty gloves on.
Right, right, I
You're
got you.
not, yeah, you're not.
I'm just curious. I have to admit, I write shit on my gloves too. I'm a ER nurse. I'm
Yeah, but
just
if
being
you're
honest.
doing it,
I
but
got to tell you.
if you're doing like something with my daughter, and
I
then
wouldn't use the same
what?
gloves that I wrote on. I would change my gloves and I'd wash
Yeah,
my hands.
that's
You're not wrong. I would.
exactly.
Yeah.
Yeah, not like doing something and you get shit on your gloves, and then you're gonna leave the room and document. That to me is nasty. I'm
Right.
sorry. Maybe that's the clinical nursing instructor in me too. I don't know.
No, I mean,
But
but your world is different because you work in L&D, so I don't know what you kooks do up there.
well, I don't write on my gloves. And I don't put
Uh,
like pens and shit in my hair either.
oh, no, I don't do that.
Yeah.
I steal my
Uh,
girls. I don't know what the hell you call them. I steal my girls, the hair ties and shit from my girls.
well, that's okay. That's okay. But anyway, so the resident came in. It was a resident. And she said, "Oh, so she's back for more respiratory issues." And she just, I don't know, she didn't really seem that intelligent because she wanted to work Luna up for Kawasaki's. I said,
Wait,
but she doesn't even have a rash.
wait, hold on. So I had to recap. We went from a barky cough to a cold or flu to what else they say she
Well, they
had?
said the croup,
Croup to
strep
Kawasaki,
throat,
strep
yeah,
throat to Kawasaki.
to Kawasaki's. And I'm like, are you
Holy shit, man!
effing kidding me? This is not Kawasaki's. Oh, and with the green specks in the little Ziploc bag, she took that bag and threw it on the counter. She said, "No, this is nothing. This is just respiratory."
So she wouldn't even look at the stuff you brought her.
No, no.
That shit
Just,
makes me crazy.
yeah, just threw it on the counter. And I said, "Okay, well, in my whole nursing career of 25 years, I've never seen anything like this." No response.
That's crazy, man.
Yeah. And so we were in that room for 4 hours. They had nursing students coming in, a nursing student doing a cath on Luna, doing like a straight cath for a UA, and just doing like a workup. And I said, and I even reported to this resident. I said, listen, I've taken a listen to her. She is diminished to the left. Can you just get an x ray? Can we just do a chest x ray? No, it's not necessary. I said, okay, all right. So they continued to work her up for Kawasaki's. So 4 hours later, after arrival, different attending, and I should say a different attending came in. who knew what the fuck she was doing, finally. And she looked at the bag. I told her my concerns and I said, lung sounds diminished to the left. Can we get a chest x-ray? She goes, let me take a listen to her. She took a listen to her and she said, you're correct. Let's go ahead and get that chest x-ray ordered. And things moved so quickly from there. So I don't know if
So how many days
she
did it
looked at
take you?
those
How many
specs.
days though did it take you to get the chest X-ray finally?
Well, she initially went in on a Tuesday to peds, but I don't think at that point I was asking for a chest x-ray. It was 2 days later, that Thursday when I took her to that I was asking for a chest x-ray. So Thursday, Friday, and now we're at Saturday night.
That's crazy though.
Saturday night, like
Tuesday, Wednesday, Thursday,
6:45.
Friday. So three
Yeah.
and a half days it took you to get a chest X-ray.
Yeah. And I believe that this attending looked at those specs and maybe she actually was doing some critical thinking and like, okay, we better get a chest x-ray. Or maybe with her ER experience, she's like, oh shit, this could be the corrosiveness of a battery. I don't know because things move so quickly. I didn't even have time to ask her. As soon as we went back and Luna got the x-ray, as they're wheeling Luna back down to the ER bay, surgeon was already in the room waiting for me, or waiting for Luna, I should say. And they're getting her prepped as fast as they can. And the surgeon stated, I have some very scary stuff to tell you. We don't know how long this battery has been in her for. Because I shared with her, she's been presenting with symptoms for close to 10 days now. And she said, we don't know how long that's been in there, but a burn starts within 2 hours. And she said, so we don't even know if it's reached the mediastinum. If that's the case, she said, your daughter may not survive this surgery and we need to get her up there now.
That's fucking scary.
Yeah. And I'm there by myself with her. So went up to pre-op as they were prepping her. And it's very scary because you don't know if you're going to see your child alive again. So the surgeon came out, brought me a specimen cup with the battery in it and gave it to me. And she said, here you go. Here's the battery. My first question, she said, Luna's fine. She's in the PACU. I said, okay, are you going to send her over to the PICU? No, it's not necessary. We'll just move her out to the floor. And most likely you'll be discharged home tomorrow. She said, we'll go ahead and get a swallow study test done, an esophagram. We'll do that. And then pending results, we'll send you home.
So what is an esophagram?
So it's the Luna had to swallow some barium just to see if there was any type of connection issues, just to see if that battery burned a hole. So it's a fistula through the esophagus and trachea. So the esophagram did show that there was a connection issue, but at that point in time with the esophagram, they don't know how large that connection issue is. So she had a TEF, a tracheoesophageal fistula.
One more time, you said TEF.
TEF, tracheo,
Transesophageal fistula.
no,
Oh,
tracheoesophageal,
tracheoesophageal
esophageal fistula,
fistula.
because there was a hole in her trachea and a hole in her esophagus. But Kevin, I have to back up because when I asked the surgeon about going to the PICU for close full monitoring, and she said it wasn't necessary, throughout the night, Luna's sats were dropping, like down into the 80s. I kept calling the nurses in, and they're just readjusting her pulse
Oxygen level.
oximeter.
Yeah. Oh, they didn't even adjust the oxygen, just a sat, just a probe.
Yeah. Oh, it's just a
Shit.
probe. It's just a
Oh, damn.
probe.
All right.
And so the next day, which was on Sunday, she goes for the esophagram at about 11:30. So now I found out from Stanford that standard of care is if you know, well, not if you know, but If you have a patient that has ingested the button battery, you need to send them for an esophagram right after removal of button battery. And they waited 13 hours.
So standard of practice, you should do it immediately, but they waited 13 hours.
Correct.
And did you go back and ask why they waited so long?
Well, at that point in time, I didn't know that that was standard of care.
I got you.
I didn't find that out until later on when she was up at Stanford.
That's fucking crazy.
Yeah. So once they found that there was a connection issue, like I said, that was around 11:30. Surgeon came back up to med surge and talked to me. I think it was about 1:30, like so 2 hours later. And she said, so there is a connection issue. So we're gonna have to take her back into the OR, intubate her. Our plan is to leave her intubated because of that connection issue. And we will probably put in a G tube because she'll need G tube feedings. However, when they took her in, they wanted to bronch her just to see, what's the size of that TEF. And so after surgery, the surgeon came out to talk with me and she said, the injury is much larger than what they expected. And that's something that they've never or don't have much experience. I don't think they use the word never, but they said we don't have much experience in managing a TEF that's 1.5 centimeters. She said Luna will probably need reconstructive surgery. So we did not place the G tube. We didn't want to mess around with anything in that area because we do want to transfer her up to Stanford and we want Stanford to be able to manage that. Because if she would need reconstructive surgery, like part of her stomach and reconstructing it, for her esophagus and trachea, they did not want to mess around with G tube placement because of that.
Scary as shit, though, isn't it?
Yeah, it is. So she was transferred. They wanted to airlift her, but because of inclement weather, they had to do ground transport. I did see Luna over in the PICU at they were supposed to be placing a PIC line, PIC line. And so I thought she had the PIC in place. Well, the next day when I go up to Stanford, or the next morning when I arrived, they're placing a PIC. They said never did it, or something happened. They really didn't give much information on that. I said, well, this is really odd because I was there as they were trying to place the PIC line.
So
So
did you ever ask about what happened and why did it not
I
get
did.
placed?
I asked the ER doc, the attending at Stanford, and he said, honestly, I don't know the answer to that. He said, we're placing it now. And again, he just reiterated that your daughter's very critical, organ failure, respiratory failure, because of the location of the burn. He said she's at a catastrophic risk for a bleed, that they would have the Blakemore at the bedside at all times, and that ENT is the only providers that can intubate. So anytime she would need to go for a procedure, if something were to happen and they needed to work with her airway, only the ENT team would be able to handle her airway. So she had a critical airway. And then, like I said, that catastrophic risk for a bleed, organ failure, respiratory failure. So
It's
she was not
crazy.
expected to survive.
Man. And how did you feel? How would you feel at that time when you know what I mean?
Well, overwhelmed and shocked. And as I was driving up to Stanford, one of my friends was bombarding me with texts on all the kids that have died from button battery injuries.
Oh shit, that doesn't
Yeah,
fucking help.
I know.
Like, what the fuck's wrong with you? Don't be doing this shit to me.
Yeah, as I'm driving? Are you kidding me?
Yeah, what the fuck? Not just that, but I'm sure it's fucking like scary.
Yeah, very scary. I
Yeah.
mean, every time the phone would ring, I would like jump. I was like shaking because I did stay over at the Ronald McDonald House at night. Just to shower, get something to eat, sleep a few hours, and then head back to the hospital. But if the phone would ring and I would see Stanford's number, I was just terrified, like getting the news that,
Yeah, I would
she
be too.
didn't make it. But I have to say, I don't have any complaints about any of the providers. Stanford, they were amazing. Dr. Meister, the ENT that saved Luna, she was the attending. Anytime she would call, she would say, Joanne, Luna's okay. I just want to let you know, Luna's okay. But if there was something that she needed to tell me, or maybe Luna was going down for a procedure, just letting me know, hey, you may want to come over now, or just giving me updates. But I appreciated the fact that as soon as I would pick up, she would say, Luna's okay.
I know, but still, this, I
It's,
mean, I got 6 kids and I can't fucking imagine, I mean, Bubba was sick and he lost a lot of weight because he would shit and throw up a lot and he became very cachectic. And I've never been scared of shit in my life, but I was like, holy fuck, like, so imagine that your kid's gonna die. It really fucks you up. Like,
yeah. And, I
more
don't
so
have,
probably for a woman than a man because, you bore this child and make your
yeah,
eyeballs crazy.
yeah. It just, I think the worst part of it, I mean, all of it was bad, but when she coded,
Oh,
they were
fuck.
trying to prep her to go down for a CT scan. And, she's already snowed with meds. This was probably like a week after admission to the PICU there. But they're pushing multiple doses of Versed. Then they're putting Kevin, I think you're going to have to help me with this one because I'm not ICU. It starts with an R. They try to go down nasally with it.
What was it for?
Honestly, I don't
I
remember.
know, but
I
what was
don't
the
remember.
device for? What were they trying to use it for though?
Well, it's almost like an NG.
It's not a Dopphoff, is it?
No, but it starts with an R. Like, I want to say
Hmm,
something like Repivical.
I don't know. I've never heard of that before.
So they weren't sure if she like bronchospasm because of placement, trying to place it, or was it due to pushing the Versed and respiratory depression. So that's what they were talking. I mean, that's
Is it called a is it
after
called a
they pushed.
Riley's tube?
No,
No.
I'll find it. I know I
Yeah.
wrote it down somewhere.
All right.
So her sats, I mean, I'm in the room and I'm seeing her sats and I'm telling them her sats are dropping. I think I screamed it. Like,
Shit.
and I was shaking, I was nervous, I was crying, and I'm like, I need to leave the room because they need to do what they have to do, and I don't want to be in the way.
I know, but still, it's got to be traumatizing from you.
Yeah.
You still have PTSD?
I think I have PTSD from the whole situation.
You admit it?
I get PTSD every time
Talk about
have
it?
to. No, every time I have to drive by that shithole called. Yeah. And then one of my friends this morning sent me a text about the CEO of, and I told him, I said, I don't even want to read anything about that stupid fuckwad. And he thought that was funny, but I don't. Every time I see anything that has to do with, I want to lose it.
I know it makes you crazy because,
But Stanford, anytime I see anything with Stanford, that does not give me PTSD because they saved my daughter.
right.
I have zero complaints about nursing staff. They were all amazing. They knew what they were doing. They were on top of things. And same with the physicians.
So
I
do you
don't
think
have one complaint about them.
but do you think it's training? Do you think it's
I do.
knowledge?
I do.
Because, I mean, we're all medical professionals. I mean, why is it that one hospitals seems to have better outcomes and services than others? What is it? Because the facility you're talking about is a magnet facility, so they should be at the top of their game.
Well, used to be a magnet facility.
Are they still not? Are they not any longer?
I don't think they are.
Hmm.
I thought you and I had this conversation about
No, I
their
mean,
magnet status.
maybe we did. I suffer from CRS, so.
Well, you know what? After this whole experience, I suffer from CRS as well.
Well, for you, since we're talking about your story, I did create. I don't know how effective it is, and I didn't look at it. Maybe I should let you see it before I start giving the shit out. But I created a little ebook, it's only 5 pages long, about button battery management. And then I created a little quiz for people to take if they listen to this episode, mainly medical professionals. And if you download the book and take the quiz, I can give them a CE for listening to this episode and your story. So that way we can try to, make sure that we educate nurses and other medical professionals not to miss shit like this.
I agree. And also, after Luna was discharged from the hospital, by the way, she's doing exceedingly well. You would
That was
never
going to
know
be my
that
next question.
you would
How is she doing?
never know that she had this
Kids,
injury.
kids are fucking resilient, isn't she?
She is. Like today, she's got a big day today. Every Wednesday, we do swim practice Wednesday mornings. She does go to speech, but she's doing incredibly well with her speech now. And then she goes to dance. She goes to dance lessons. So she's very active, very engaged. I know, Kevin, you would absolutely love her because I did share with you on her second birthday, right after she was discharged home from the hospital last year, last June, she was discharged, and her birthday's in July. I went to light her candles, or two candles on the cake. Lots of people here celebrating her life, and her birthday. Because
That's good though. I like that.
we didn't think that she was going to see her
Yeah,
second birthday.
that's craziness,
And
isn't it?
yeah, as soon as I
And how
lit
old is she
those,
now?
well, she'll be 3 next month.
Holy fucking shit.
Yeah. As soon as I lit those candles, she said, "Oh shit."
I love it. See, my kind of kid, man. Cursing, I
Yeah.
love it.
So you want to talk about a tough kid? That kid is tough to be able to survive something like this.
I like it though.
And
That's good.
she's got a sense of humor because listen, she was born breech. She came out butt first,
Right.
normal natural delivery, not a section. So she's got that sense of humor from the get-go, from the beginning.
So she's feisty like me.
She is feisty.
I like that. That's good.
Yes.
I like that.
She's got grit.
I love it. That's good. All right,
So,
so
yes, she's doing well. And I just wanted to add that as we were being discharged from Stanford, I shared with the attending that because I said, "Thank you so much for saving her life." And she said, "Joanne, I didn't save her. The man upstairs saved her."
oh, that's nice.
And
I'm not a very religious person, so
yeah, so she said it was the man upstairs. And I said, "Well, I have to tell you that it will be our mission to educate people to make sure that this doesn't happen to other families." I think
right.
the education needs to start from the beginning. And with me having the birthing support center and working with new parents, I do have safety information that's part of the prenatals to review button battery safety, child safety. I also started a infant and child safety class as well.
All right. Well, I have to start pushing that. I definitely will let you read my little ebook, and you better tell me before I start publishing that shit out to people.
Yeah. And then one more thing before we go, and
All
I
right.
know a lot of our nurses do not know this, and this is one question I know that you ask nurses. Do you have honey in your Pyxis?
So I just asked this yesterday in my class. I said, you should have honey in your hospital ER, your picture somewhere, and everybody's like, no, we don't have that shit. So that's something I would like to know. How many of you out there have honey in your EDs, in your pictures, or wherever the hell that you think you should keep it? Should it be in the pictures? I don't even know where the fuck we would keep it.
Yeah, I mean, would it be just like the little, I don't know, like
See what I mean?
little tiny little containers because it would just be a one-time use?
Right, because it's only 10 milliliters. That's how much you should use.
Hmm.
Yeah. Oh, that's a good damn question. See what I
Well,
mean?
I think it should be stored in the Pyxis. Doctor orders it.
Yeah. So I'm gonna find that out. I'll find that out. So the rest of you yahoos, that's your homework. Does your Pyxis or does your ER, does your hospital keep honey? And is it readily available? And do you know where the fuck it is? That would be a good question to ask people. That's good.
Yep.
All right, that's awesome. Well, I appreciate you taking your time to talk about your story with Luna.
Thank
And
you.
I know I've said this already, and I know people's already said this. I'm sorry that you had to go through that shit. I'm sorry that you didn't get the services that you deserve, especially being a nurse and shit. So if it happens to nurses, what does it do to people that aren't educated in the healthcare field? You know what I mean?
Well, they
So,
just listen to their fucking goddamn provider and not take their kid back. That's why
so,
kids die.
all right. Well, we're gonna do another episode soon. Hopefully, you'll be on fucking camera next time. Get your
I
fancy ass
will.
up and dressed up, because we're gonna talk about your business next time. One more time, repeat what your business is.
Peaceful Passages Birthing Support Center.
Perfect. So we're gonna talk about that on the next episode. All right.
Hey, thanks so much for having me, Kevin,
No, I
and
appreciate you.
educating
No, I
everyone
do.
about the dangers. So
Yes, I
thank
love
you.
it.
Don't miss out. Engage with us weekly. Share your thoughts, and let's transform the nursing landscape together.